views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. Over the last year, we've all been going through a lot, to say the least. Mental health professionals are reporting numerous fundamental issues, like people simply not sleeping well, unable to deal with the myriad of pressures brought on by financial, job, and relationship issues, and of course, children who have not been able to be with their friends and find proper outlets for expression in schools and other activities that they normally would engage in. Last month, the Coalition for Behavioral Health released a report about the impacts of COVID on non-for-profits that focus on providing mental health and behavioral services, especially to our most underserved residents. And so tonight we have a couple of behavioral health pros who will help us understand what so many of us are feeling and also how to get the people the support they need as we all struggle to emerge from this very difficult pandemic. Please join me in welcoming to BronxTalk the President and CEO of the Coalition for Behavioral Health. It is Amy Dorin. Ms. Dorin, nice to have you with us.
Thank you. Lovely to be here.
And the Chief Executive Officer of Astor Services for Children, it is Yvette Bairan. Nice to have you with us, Ms. Bairan.
Nice to be here with you as well, Gary.
Thank you so much. Let's start with you, Ms. Doran. Let's just get a kind of an assessment. How are people doing right now? You heard the way I characterize it. Frankly, I know for myself. I mean, I'm working. I have a job. Have a family, things are stressful. Give me overall of what you and your colleagues in behavioral health are seeing.
Absolutely. So the Coalition for Behavioral Health represents over 100 community agencies that provide mental health and substance use services to the whole greater New York metropolitan area. And we're seeing, I think, a 77% increase in requests for services. People are depressed, often for the first time due to the pandemic, the isolation, the fear, unemployment in families, food insecurity in New York, which is hard to think about, and people presenting that have never had services before, but for the first time are feeling emotionally upset, depressed, anxious, fearful.
So with the numbers changing and the numbers of people who need support increasing, obviously, and some of them, are kind of not used to going through some of these processes, what has or have you and your members had to do to keep up with the need and try and address this?
So our member agencies were heroic. As you may know, our sector is not one that is terribly well funded, and many of our agencies struggle after years of increasing costs and reimbursement rates that don't keep up. But they all stepped up to the plate, often at their own expense, to provide things that were not reimbursed. And
before you go on, give me a sample of the kind of thing that they needed to provide that they didn't have to provide before.
So aside from an array of mental health services and substance use services in a very difficult environment, one of the highlights of the pandemic was the use of telehealth. For the first time, government allowed our clinicians to use telehealth to provide services, and that was amazing. And literally in record time, our member agencies transitioned thousands of people who were in care to telehealth services.
And what did that mean? I'm going back to that original item that you mentioned. What did that mean in terms of cost or other issues frankly, for the client, you don't have to pay for transportation. I mean, there's ways of doing it. But what happened on the professional side?
So government ensured that the rates for that would continue through the pandemic, so that agencies could get reimbursed. It really, because nobody could go out and there was, so many people were sheltering at home, it really allowed services to continue in an amazing way, to really sustain and provide continuity of care for so many people that were either in services or requesting services.
Was there an issue with technology? I mean, we had it with in schools. I'm guessing some of the providers may have had adequate technology, but then the clients don't have the technology, and so it's communication. It's two ways. So you had to get involved in that, which is something you never had to do before.
Exactly. That is an incredibly important point. That the notion of what we're now calling the digital divide. People that did not have the technology, did not have access to technology, suffered. Staff that didn't have it, and many agencies stepped up to the plate to provide it. Many of our clients, and by the way, many of the clients served lived in those communities most affected by COVID. Poverty, a lot of poverty, and people who just did not have the technology, and that became a challenge.
Last question before we get to Ms. Bairan. Let's just talk about the effectiveness of this telehealth process. As effective, almost as effective. You were happy you had it, because if you didn't have that, you'd have nothing. Give me an evaluation of its efficiency, and are you satisfied, at least on that level, that you've been able to do something concrete?
Yes, I think there is a lot of satisfaction in the community, both on behalf of the clinicians that provided the service and on behalf of the clients who could be sustained in care. Are there things to work out? Of course. But it really, we were allowed to use telehealth. I mean, the regulations changed very quickly to really help, thousands of people that would have been disconnected from mental health care.
I'm going to get back to you, and when we do, I'm going to ask you about the future and if this portends maybe a new look at how some of these services can be delivered. But I do want to bring Ms. Bairan into the conversation. First, let's talk about Astor. Astor has a great reputation, and they've been working with children and families. Families, of course. I'm really interested in children. Talk to me about what you have found with the children, either in school or not in school. Give the same kind of overview that I just asked Ms. Dorin about.
Sure, absolutely. I think the most challenging part of this entire pandemic was the fact that schools shut down and went remote. And if you had a child in school, that meant that potentially the first couple of weeks, you didn't know if your child was missing a class or not missing a class, because to get the technology and all the pieces in place was really challenging. So for us, the challenge was that continuity of care, right? Astor provides in-school-based mental health services in about 30 to 35 schools in the Bronx. So when the schools shut down, that meant that we weren't going to be able to be in the school as a provider providing those mental health services. So it meant that we had to figure out, how do we make sure that that child is engaged at home and that we are able to still provide them with that mental health service that they need. And it was a challenge. And we did it not just through through having a laptop available to do the teletherapy that we needed to, but we did it through the phone. We did it through FaceTime. We did it through whatever capacity we had to, in order to make sure that that child was getting served and that they were getting that continuity with the least disruption as possible. But it was a challenge.
Listen, these were very serious issues, and I'm sure for some of the children, they never had anything like those kind of issues and maybe never needed support. What were the kinds of things that you had to do to help kids, do better in every way?
Well, one of the things we saw multiple mental health diagnoses increase, where we would be seeing a child coming into us maybe with an attention deficit hyperactivity disorder diagnosis now we saw them not only having that diagnosis, but they were coming in having depression, anxiety, and really trauma as well as a result of some of them lost their family, they lost parents, they lost grandparents. So we have children who were not only already dealing with some level of depression or some level of anxiety. Now they have trauma because of the loss in the home. Some of them lost their homes because the parent lost their jobs. So we're really, really, struggling to make sure that the family stay connected, but that the child is getting through such a difficult time in the most, helpful way that we can for them.
This is really an important dialogue. I don't want to say happy to hear you say those things, but I think it's very important to say it, because when we hear about media and parents talking about, well, my child's not doing real well, it becomes kind of a generic thing. But to understand a child who lost mom or dad, imagine a child has to go through that, which it's just, my heart bleeds, literally. Then they come out and they say, you have to wear your mask all the time. And the kid thinks it's like the video games that we shoot those guys down with masks. And now everybody they see, they can't see their faces. It's just, I wish I had the words. I don't have the words. And I have tremendous respect for you and the people who work with you for dealing with it. Do you find, and did your staff feel successful on some level, or are the problems so big that you're just treading water, keeping it going? Or did you feel that you really made some impact?
I mean, we definitely felt that we made some impact because we continued to provide the services that were needed. However, needless to say that we definitely still are in a situation where being able to work with the school systems is critical. A lot of it, and we've heard it from teachers in the Bronx who said to us, I'm trying to still engage this child in school. Meanwhile, I know that they're going through these issues. How do I get them to learn math and English when they're not in the mental state to be able to really learn the things that they need to learn? So we got to treat them.
And not only do those conditions exist, but we're doing it in a non-traditional way. And instead of looking at a teacher who might show a face of kindness, they're looking at the same computer screen I'm looking at. I can deal with this, but for a child who has needs and a Bronx kid, man, again, respect for you. One last question, and then we'll go back to Ms. Dorin, and I do want to talk about what we need now as we're really going to bring the kids back to school and what kind of care they need. But I want to talk about the insurance. Ms. Dorin talked about governmental support for some of the services, that it was very useful because COVID-related services were covered. Did you find, or do you find you have that same financial support, or is it still kind of like a problem because many people don't have adequate health care, or they have health care that, they pay $400 a month and they still got to pay $80 a visit, Give me some of that so we can understand, the whole ballpark here.
Yeah, I mean, we're never going to deny a child who needs access to care that access. However, it is obviously a strain on the organization to take those cases. But I would say that, we need to make sure that the children are insured and are getting the services that they need. And that's our primary focus. And how we pay for it is something that as an organization, we have to figure out, right? We work with our legislators, we work with the commercial payers and everybody that we need to. But technology now, I have to say, is one of the most important things that we need. We need to be able to have the bandwidth. We need to be able to have the laptops, the phones available for both the families and for the clinicians and the workers to be able to do their jobs. So in terms of resources, that's a big part of it. We do need that technology.
Well, it's a very difficult situation when the people who you are serving don't have the technology. I mean, that really, it just creates a dynamic that sometimes seems to me practically unsolvable. I know I have some things I want to follow up with Ms. Dorin about, but I know I was watching you while you were listening. Just give me your response to some of the things that you heard.
So, Yvette spoke very eloquently about the needs of children. And I think it's important for all of us to remember that while the virus will end, thank goodness, the psychological impact of it is not going to end for a very long time because of what Yvette spoke about, particularly with children who have sustained loss, food insecurity, trauma. That doesn't heal overnight. And so I think that our community of provider agencies are going to have to open their doors and serve children and adults affected for a long time to come.
I know you studied this extensively, and you had put out a number of different points as recommendations for the future. What do we need? I'm asking you to summarize a very significant report very, very briefly, but what's the biggest thing that we're going to need as we go forward?
So our agencies will need reimbursement for technology to make sure that their clients and staff have the technology to work in this way. We need to get together with government and develop some comprehensive crisis plans so that we will try to be more prepared, although hard to be prepared for what happened, but that would be a help. And honestly, Gary, keeping our community well-funded. There is no health in communities without behavioral health. And with an increased need, we need to make sure that our agencies receive the funding to be able to do what they need to do in terms of opening their doors and serving so many people.
I'm so afraid to ask the question that I'm thinking, and that is insurance companies. Do they understand that this is significant, as significant as providing support and coverage for somebody who broke their arm? In other words, it's very obvious they broke their arm. We need the X-rays. We're going to need the care. But is it still a hard sell to insurance companies?
To some extent, it is. How do we make sure, as you say, that mental health and substance use treatment are as important, if not more important, than care for a physical ailment? We have to really make sure that insurance companies will pay enough so that our agencies can provide the necessary services.
Kids are going back to school. What is going to have to happen? Are we going to need more counselors in schools? Are we going to need to retrain staff and have them figure out what to do? Are the children going to be able to even continue doing telehealth? I mean, how are we going to deal with this? Because as we just heard, the problems aren't going away.
Yeah, those are excellent questions. And there's a couple of things we need to do. First is we need to be able to continue to do telehealth so that we can meet the children where they're at, right? So if we're not able to engage them in school like we would like, then we need to be able to engage them somehow. So even if it's that's at home after school in the evening, we want to be able to do that. We also need to be able to provide some training to the school system so that they are as prepared as possible to make good referrals. So they need to be able to identify when a child is in need of mental health. And training is going to help those teachers and those school social workers and psychologists do that. That's another big piece of it. And the last thing I would say is we need to make sure that we have enough clinicians in those school systems throughout the Bronx. We need to make sure that no school is left behind. The same way we don't want any child to be left behind. The only way we're going to do that is by making sure clinicians are in the school system.
I want to ask almost a more fundamental question. It's something that I think about a lot in terms of our curriculums. And, we've had children and teachers as well, geared up for tests and all those things. My thought is this is a great time to reinvigorate music programs, to reinvigorate athletic programs, because we're not going to get the kids to just come back in and focus on difficult math and social studies and English and all those other things. We got to get them right. And that's my thought. And so, Ms. Bairan, what do you think about that? And is that really possible? I mean, we do have a new chancellor, and I know people in the Bronx love who she is and what she's been about. But to me, that's what, if I had these children in class and I haven't seen them for a year, I would bring out the wood blocks and the tambourines and let the kids sing and dance and play. And then we can talk about math and English and all those things. What are your thoughts on that?
Yeah, I love that idea. I think it's
so I can write the curriculums then? Is that what
yeah, well, you know what? I love the idea of giving the flexibilities to the teachers to be able to bring those kinds of things into the classroom, but also for those extracurricular activities to be there more consistently with better funding, because socialization is such a critical part of getting these children back where they need to be, and they've been isolated for so long, and that's a good way for them to socialize. Sports, music, art, all those are critical. So definitely it's something that the school systems need to consider and need to invest in.
You know, as a sidelight, and I know this is not directly what you deal with, we also are going to have to, when we bring those kids back in, we're going to have to make sure everybody's safe. We're going to have to understand all the health risks, all the social distancing risks. I mean, I'm sure you agree with that. It's not exactly what you're set up to do, but right. I mean, that has to be part of a whole look at what to do in our schools.
Mm-hmm. Absolutely. You want that holistic approach, and the best thing any principal of any school, any superintendent can do is really look at it in a holistic way, because it can't just be the educational piece. There's just too many moving parts right now and too much to lose if we don't think about it more holistically.
I have to tell you, I've asked this question. I brought this up every time this topic comes up. I'm going to keep beating that horse till we get it to win that race. Ms. Dorin, I want to talk about what we may have learned through this very difficult time. I know I have learned, and in media we have learned about the value of the technology, that we can do Zoom conferences and they don't have to bring you in all the time to do a good program. What have you in the behavioral industry really learned that it can be useful as we begin to emerge from the pandemic?
We need to be able to try to plan better for a similar emergency. We need to, as you say, have a renewed respect for technology and how we can help people. We need to also focus on our workforce. Our workforce was, and Yvette, I'm sure you'd agree with me, our workforce was heroic. Many of them could not use telehealth. They had to come in and be available in person to people with mental illness. And the sector has had difficulties with workforce even before the pandemic because our salaries are low. Many people don't want to come into this sector to work. Many of them want to leave because they can get higher paying jobs. So I think this pandemic really highlighted a renewed respect, not a renewed appreciation for our workforce, and really the fact that we need to really figure out how to get more people in, because we're going to need an amazing workforce to serve all of these people that are coming in for help.
Do you view at this point, with now that you have a year's experience at it, do you view telehealth as a Band-Aid or something that we can live with and we can find, ways to use it in the future that might be advantageous?
Yes, I don't believe that it will go away. We've used it successfully. It has kept many troubled people engaged in care, and it's not going to go away. And we hope that the rates will be able to allow us to continue.
One of the things, I'm just so tempted to ask this question. One of the things that insurance companies, when they allow for coverage of mental health support, is, they kind of count how many people they have, they've licensed, so to speak, for their companies. And then if, somebody who's not part of that circle or doesn't receive, their clients don't receive benefits from them, they say, well, we're kind of covered. Do you find that some of the providers are getting turned down by insurance companies?
Insurance is a, very complicated business, and our goal is to make sure that insurance companies pay for the services that are needed. As Yvette said before, our agencies will often see people whether or not they are insured to be able to provide the service. There's that social conscience. But the whole issue of insurance how much they pay, it is a tricky one, and
Yeah.
we're always looking at that.
That's another 30-minute program for me,
Absolutely.
at least. If not more.
Absolutely.
Let's talk, Ms. Bairan, let's talk a little bit about the hotline. Now, you launched a hotline, and you saw immediate response to that hotline. Is that the kind of thing you think that, well, we never had it before, and maybe now this is the kind of thing that can be useful? So let's talk a little bit about your experience with that hotline, how it's worked out.
Yes, I think we will always maintain that hotline. One of the things we realized is that we launched it probably within a week of the shutdown.
Wow.
So it was really important for us to be able to engage clients in any way. If they called, that they knew that there was a hotline they can call and get immediate services. So that's something that we definitely will continue. We committed to turning around any hotline calls within 12 hours. So anyone that called us, they were immediately responded to, and it's definitely something that we're going to continue moving forward.
Let's right now put out the phone number, because we want to. Everybody's feeling something. If there's something they say, I got to talk to somebody. Ms. Dorin, let's just wrap this up now. And for people who are watching this and saying, you know what, I agree with what these folks are saying. I too have issues, and they shouldn't feel, embarrassed by it. We're all going through a lot. What do you recommend that they do? How do they find somebody? You've got, all those agencies. How do they find somebody and the right person to help them with their issues?
So that's a great question. In many of our communities, people know what are the hubs for mental health services. They could call the New York City Department of Health and Mental Hygiene on their website. It lists access to services. They can often go to whatever community places there are, and people know the services, but there are lists all over. And certainly calling the New York City Department of Health and Mental Hygiene will give them access.
Well, that's another way. I wonder even if 311 can be of some support as well.
Yeah.
So just final words from you, Ms. Bairan, about for families and parents and maybe even high school students who could be watching us. What do you recommend, and what's your final message to them for this evening?
My final message would be that please reach out if you need support, if you need for yourself, for your family, for your children. It's really important that you get it, and that there's providers in the community that are here to help you, and that we're all in this together, including the school systems, the medical providers, behavioral health providers, and individuals like yourself who are willing to put us here on TV to talk about this. I really appreciate it. This is a great way for us to get our message across. So thank you.
Right. This is really all about what BronxNet Television is about, and certainly this program, BronxTalk.
And there's no shame in asking for help.
Absolutely. We're all in this together. We definitely want to thank Amy Dorin from the Coalition for Behavioral Health and Yvette Bairan from Astor Services. Next week, we'll talk about guns. And the week after, it's housing. There's a lot going on, isn't there? We thank our producers, Rebecca Hemick and Stephen Powell. And guess what? See you next week.